I would like to begin today by sharing some sad news. In addition to the death reported yesterday, I'm very sad to inform you that we have had 5 additional deaths today, bringing Alberta's total to 8. 2 of the deaths occurred in long-term care facilities or seniors housing, a female in her 70s at Calgary's Mackenzie Town facility, and a male in his 80s at Edmonton's Rosedale facility. The remaining 3 deaths include a female in her 50s in the Calgary zone, a male in his 80s in the Edmonton zone, and a male in his 30s in the North zone. I would like to extend my deepest sympathies to the families and loved ones of these individuals. This news is heartbreaking for all of us. Although these individuals had risk factors like older age or chronic medical conditions, their lives mattered as much as any of ours. This has been one of the hardest days yet. Imagining the grief that these families are facing, and my heart goes out to them. These deaths speak to the seriousness of the COVID-19 pandemic and why aggressive measures from all of us are needed to contain the spread. In the last 24 hours, we have confirmed 29 cases of COVID-19.
This is a difficult day for all of us who work in healthcare. As we've heard, there have been several deaths related to COVID-19, and I too would like to express my sympathies and those of all of us who work with Alberta Health Services to the families, friends, and loved ones of those who have passed away.
Please remember, following the public health guidance will save lives. Those of you on home isolation, thank you for doing your part. Those of you who chose to stay home and away from others because of an illness, whether mild or severe, thank you for doing the right thing. Those of you who go to work in critical jobs, like taking care of vulnerable people in long-term care, thank you for doing so safely. We are all in this together. On the topic of how we can all do our part, yesterday I had the opportunity to connect with my counterparts across Canada as part of our Special Advisory Committee on COVID-19 response. During this call, we had significant discussion about the rules under the Federal Quarantine Act that require any Canadian under mandatory self-isolation to remain on their property for the duration of the self-isolation time. While some provinces, such as Alberta, had previously allowed those who were in self-isolation and who were also well to leave their property for short walks, the discussion with my colleagues was about weighing out the risks and benefits of this exception. At the end of the discussion, we came to a consensus that because there is a risk of people getting ill while they are out, we will have a uniform recommendation across the country. If you were quarantined because you recently came back from outside the country, or if you were a close contact of a confirmed case of COVID-19, you must remain on your own property, rented or owned. You are only permitted to go outdoors on your deck, in your yard, or on a balcony. Under no circumstances should you leave your property during the 14 days of self-isolation. This means that if you are under mandatory self-isolation, you can no longer go for walks in your neighborhood, at the park until your self-isolation period ends. Do not have visitors over, do not go to public areas and spaces or community settings. Arrange to have someone pick up essentials like groceries or medication for you. People who live in apartment buildings or high-rises must stay inside their unit and cannot use the elevators or stairwells to go outside. This applies to everyone under mandatory self-isolation, including both people who are feeling well and those who have symptoms of COVID-19, including cough, fever, runny nose, sore throat, or shortness of breath. I know this is incredibly difficult. Staying indoors or close to home for 14 days is a very long time, but this is what we must do to protect each other. This also means that we need to look out for our neighbors who are in a time of self-isolation. We need to help each other with groceries and other essentials so that those who are on self-isolation can follow the rules. Staying inside can save lives. In addition to staying home when sick or in quarantine, physical distancing is also important. This means staying 2 meters or about a hockey stick length apart at all times. Having said that, I know that there are some situations where this may not be possible, such as carpooling. If you are not under mandatory self-isolation, you will not be fined for traveling in your vehicle with your family or carpooling with coworkers. However, if you are feeling unwell, you must stay home. This is also not the time for people to go out to their summer cottages or seasonal villages to self-isolate. Services and supports are limited in these communities. Please stay in your own home and away from others if you are feeling unwell. Each of us must continue to do everything we can to flatten the curve and keep our friends and family healthy. While Albertans must practice physical distancing, it is important to remain socially connected. Text or call an old friend you haven't spoken to in a while. Video chat with a family member or loved one. We will need to find new ways to connect with each other while being physically separated. It is through helping and looking out for one another that we will overcome COVID-19. I call on all Albertans to treat each other with kindness, acceptance, and respect. Look out for each other. We are all in this together.